In regards to elderly patients, we're talking about optimal blood pressure and stroke. And I am with Dr. Maciej Banach, and this is the Chair of Nephrology and Hypertension at the Medical University of Lodz in Poland. Okay, the regards trial is being presented here at the ESC meeting. Let's talk about it. What did you look for?
Regards study is one of the largest epidemiological observational study which was carried in the United States between 2003 and 2007, and over 30,000 patients were included. The main aim of the regards study was to look for the risk factors for stroke, and on the basis of these results we wanted to see what is the optimal blood pressure level in the elderly population. We not only wanted to see the patients over 65 years old, because in such way we define elderly patients, but we wanted also to see how the situation looks like in patients pre-elderly patients between 55 to 64 years old. So therefore we have three groups of patients: 55-64, 65-74, and the oldest ones over 75 years old.
Now, in terms of HIVET, they suggested that we should definitely consider treating above the hypertensives who are the elderly. What is it that you're going to be recommending out of the regards data?
Well, first of all, we can we can generate a hypothesis, because it is not an interventional trial, but large observational trials, probably the largest observational trials in such group of patients. On the basis of the results we received, and we evaluated four outcomes: coronary heart disease, cardiovascular disease incidence, stroke incidence, and all-cause mortality. We can say that we should always consider reducing blood pressure level below 140 to all patients above 55 years old, because there are benefits connected to that, cardiovascular benefits connected to that. But it's also very important to remember that for our clinical practice, we should always see if our patients tolerate it well, because especially when we have patients over 75 years old, this low blood pressure may be not well tolerated by them.
In terms of treatment, is it more difficult to treat? Are they likely to require higher doses, or will lower doses sometimes be effective in an elderly population?
I think the elderly population is a great challenge, because, as you know well, we have an aging challenge all over the world. Currently in the United States you have, because I'm from Poland, 25 million people over 65 years old. In Europe, for example, European Commission predicts that by 2050, 40% of European population will be over 65 years old. So it is a great challenge also to treat them optimally. And it is not easy to treat elderly population, because we usually need to have at least 2-3 drugs, different drugs, in order to receive this optimal level of blood pressure in this group of patients. And we know well, after HIVET and after many other trials, VALISH, JETAS, and our observational trial, that we should always treat this patient in order to prevent cardiovascular events. We should always treat in order to receive the optimal levels of blood pressure. If it will be 140, below 140 for these patients, probably we would need next well-designed, large interventional trial. But this observational data we have on the basis of regards, I think it's a great start in order to start the discussion again.
Now, they're rolling out the new ESC 2013 hypertension guidelines, and already now the regards study suggests maybe a little different than what the guidelines say, right? The regards results seem to indicate something different.
I think we are maybe a little different, but we are in a line, because as we discussed it previously, European Society of Cardiology guidelines suggest that we should consider levels below 140, especially in patients below 80 years old, if patients tolerate it well. So it is individualization of our therapy. However, guidelines may be only based on the trials we have, and we have very limited number of data in this group of patients. Therefore, the main recommendation are on the basis of HIVET. That is why they suggest the level below 140 to 150 in this group of patients.
Well, this is the results of the Regards trial, and on CardioSource, please take a look at all of the coverage from the ESC meeting, and that will include material from the Regards trial. For CardioSource World News, I'm Executive Editor Rick McGuire.